Welcome to the Motivational Midwife. I'm Lynn Jones, and today we're looking at maternal pulse as part of our Back to Basics series. So let's look at the pulse. So as always, we'll start with what is it. So essentially, the pulse is every time the left ventricle contracts, it causes the vessels to expand and recoil. So it's this pulsating, this rhythmic expansion and recoil of the arteries. So every time that ventricle contracts, it pushes blood through those arteries. And you can feel that wherever an artery passes over a bone. So common sites would be the brachial, which is in your elbow, radial, which is where we probably are most used to taking the pulse. And if I do it on this one, really it's your thumb side that you're feeling it on. So you'd have two fingers and you'd place it over the vessel and you will feel that pulsation. Don't use your thumb to take a pulse because obviously you have a pulse in your thumb, and so if you're feeling over the other side, on your little finger side, you're not going to feel it very well. It's usually on your thumb side. Try not to press too hard because you can occlude the vessel and then you won't feel it as well. So you kind of it's something you need to practice all the time so you get the right amount of pressure to feel what you need to feel without occluding it. Carotid is here, and you can all feel your own carotid pulse just really when you can feel your trachea here, you just to one side or the other, and you'll feel that quite easily. And certainly if you have somebody that's collapsed, it may be quite difficult to feel the pulse radially or brachially, and the carotid may, because it's more central, may be the only place you can actually feel a pulse. Femoral is in the groin area, and popliteal is behind the knee, and your dorsalis and tibial are in the foot. And have a play. You can feel on your partner, on a friend, you can feel those pulses. The foot one tends to be on the top of the foot. Just trying to feel it on myself here. But yeah, have a play and feel all those different sites that you can actually palpate a pulse. So some of the terminology we're looking at when we're looking at pulse specifically, when we undertake a maternal pulse, we're looking for three things. We're looking for the rate, so how fast is it going? You're counting it over a minute, ideally. If it's a regular pulse, you can count for 30 seconds and double it up. We're looking at the rhythm of the pulse. Is it a nice, steady rhythm? Is it irregular? And we're looking at the volume. So is it a big rapid bounding pulse or a weak thready pulse, which would tend to equate to the change in the amount that's actually being pumped from the heart. And if it's very irregular, then obviously the pumping action is quite irregular as well. And the normal rate in an adult is usually between 60 and 80. And if you hear people refer to somebody is tachycardic or tachycardia, it means that their pulse rate is over 100 in an adult. Children's and babies' heart rates obviously tend to be much faster than adults anyway. And a bradycardia, or somebody's bradycardic, means that their heart rate is less than 50. It's quite a slow heart rate. However, there will be some adults, particularly those very athletic and very fit, that have a normal resting heart rate that is on that lower end. And there's lots of things now that can affect the pulse. So the most common things are stress and anxiety. You've only got to think of yourself and think if you get a little bit stressed or anxious, you can feel your heart beating quicker. You can feel your pulse rate starting to race a bit. And also when people are in pain, so think about our ladies in labour, they very often are in quite a bit of discomfort. So you might expect their heart rate to increase slightly. Excuse me. Infection can increase the heart rate as part of that inflammatory response. And hemorrhage, because women are actually losing blood from the body. Blood obviously contains red blood cells, and you need your hemoglobin for oxygen carrying capacity. So if we're losing blood from the body, then that oxygen carrying capacity is reduced. So what will happen is her respiration rate will increase and her pulse will increase accordingly as they try and compensate for the blood loss. And then any sort of red blood cell deficiency, such as iron deficiency anemia, as I've just explained. Rest and relaxation. Obviously, when you go to bed or someone is sleeping, you're expecting their heart rate to actually reduce accordingly, because their level of activity is obviously much more reduced. So the heart has not got to work as hard. Any sort of fluid or electrolyte imbalances. So if she gets a bit dehydrated, and this particularly relevant for labour, because very often women don't drink enough in labour. So if they get dehydrated, they're using a lot of energy in labour, their heart rate will increase. So if you're looking after somebody and their heart rate is increasing, just check whether or not they are a little bit dehydrated and maybe need some fluid replacement, either orally or intravenous. And if there's been any heart attacks or injuries to the heart attack is also known as a myocardial infarction, then that will have an effect on the heart rate as well. Exercise, if you go for a run around the park, obviously your heart rate increases accordingly. And if you have any sort of allergic reactions, so the one that comes to mind often, because we quoted quite a lot of sort of peanut allergies, where people have a really severe anaphylactic reaction, their pulse rate will be very fast, but it will also be very weak and irregular. And then there are various medications that can either make the heart rate quicker or slower. One of the most common ones that comes off the top of my head is Ventolin. So the blue inhaler that asthmatics take, if they take too much of that blue inhaler, it can actually make them quite tachycardic, so fast pulse. So looking at pregnancy and the changes that happen in pregnancy. So of all the systems, the cardiovascular system is probably the one that has the most changes that happen because of pregnancy. So this woman has got to nourish this growing fetus. So her cardiovascular system has to increase accordingly to support that growing fetus. So her cardiac output, so that's the amount of blood that is actually being pumped around, increases from 4.5 litres to 6 litres a minute. So it's quite a significant increase. And her heart rate will go up by about 20% accordingly to assist with this. Her circulating volume increases by up to 50%. And when we talk about blood and blood tests in another session, we'll look at hemodilution, and so what that increasing circulating volume actually does to the blood itself. You get systemic, so that's throughout the whole body, and pulmonary, so in the lungs you get vasodilation, because progesterone tends to relax any smooth muscle anywhere. So everywhere kind of relaxes a little bit more. So you've got an increased blood flow, but you've got vasodilation, so the blood pressure will not drop into its boots so that she collapses, but you will have this physiological dropping of blood pressure, which is why when we're looking at women's blood pressure, we want to really know what their booking blood pressure was, so you can see how that blood pressure has responded as pregnancy's gone on. The heart itself does increase in size because of estrogen, which stimulates that muscle to kind of grow. And later in pregnancy, because the uterus is growing, the baby is growing, it's pushing everything out of the way, the heart becomes displaced slightly upwards and it's rotated forwards as well. And because you've got that vasodilation, and venous return tends to be a bit impeded because of all that vasodilation, women are more prone to getting varicose veins or varicosities. In labour, we've got sort of 300 to 500 mils of blood returning to the circulation every time she has a contraction. The blood flow through the placenta is sort of 500 to 800 mils, but every time that uterus contracts, it's pushing that large amount of blood back into the circulation. And so you will often find that in labour, the pulse rate is slightly increased anyway. And obviously they have, in labour, they've got extra oxygen requirements. They are working very hard. Their body is working very hard. They may be in pain. They may be anxious. All of those things will potentially increase the heart rate. And postnatally, assuming that there's been no complications, so she hasn't had any excessive blood loss, no infections, her pulse will generally return to a pre-pregnancy rate within sort of 2 to 6 weeks. So when would we take a pulse? So at any time, really, you're going to do it as part of a holistic assessment. So for me personally, the first time I meet someone or take someone's care over, be it in a hospital setting or in a community setting, I tend to do a full holistic assessment, of which pulse would be part of that. So it's part of your 5 vital signs. So your temperature, blood pressure, pulse, respiration rate and oxygen saturations would be your total holistic assessment. And I tend to do that. So in the community, it would be when I meet someone for the first time or I take over their care, it gives me a baseline to work from. And then before I discharge them from my care, I'm going to do another holistic, total top to toe examination to make sure that she is actually fit to be discharged from my care and I don't need to refer her on to anyone else, such as a GP, if I thought there was some infection. If I had any concerns, even if I was regularly monitoring vital signs, if in between times I thought something doesn't feel right, she doesn't look well, she looks quite pale or she seems quite breathless, I might just check what her pulse is doing at that point. Excuse me. In labour, we currently, as guidelines stand, we are undertaking a maternal pulse every 30 minutes. And when we're assessing fetal heart rate, to differentiate between the fetal heart rate and maternal pulse. And then immediately post-birth, as part of her holistic assessment to ensure that there is nothing physiologically untowards post-birth. And if she's had a cesarean section, so that LSCS there stands for lower segment cesarean section, my own practice would be initially every 5 minutes for 15 minutes and then every 30 minutes and then every 60 minutes and then at least 4 hourly. But it will depend on the type of anaesthesia she has had and also your own trust guidelines as to how that varies, because it does vary from trust to trust. I trained as a nurse originally and post-theatre cases, that's kind of what we did. So I find it quite difficult to step away from that sort of model. And there you have it, maternal pulse. I hope you found it useful. If you haven't subscribed to the channel, please do. And I look forward to seeing you next time.